Hello, my name is Valeria, and today I will be reviewing Chapter 25, which covers health records and health information management. The topics I will be discussing include health record ownership and storage, health record content, health records in radiology, code functions, correcting or amending a health record, and patient access to a health record. All healthcare organizations, such as hospitals, diagnostic centers, and physician practices, require to manage health records on all persons receiving healthcare services. A patient's health record is a permanent, personal, and lifelong documentation of health information of the patient during any healthcare visit. Healthcare organizations also abide to the Health Insurance Portability and Accountability Act of 1996, or formerly known as HIPAA. HIPAA is a federal legislation that provides data privacy, security, and the establishment of standards for electronic exchange of health information in order to improve the efficiency and effectiveness of the healthcare system. The ownership of a health record belongs to the physician who created the document and by the facility in which the record was created, while the information gathered within the record is owned by the patient. When it comes to the storage aspect of a health record, the document is preserved for a minimum of 5 years from the day the patient was last seen. This also includes radiology records, such as film scans, report copies, and other imaging records. When a patient receives either a diagnostic or therapeutic procedure, both the radiologist and the radiographer must document in the patient's health record. This process is known as charting. According to the Joint Commission, or TJC, a health record must contain adequate information to identify the patient, acquire a diagnosis, justify the treatment, document the procedure and results, and facilitate continuity of care. TJC standards also require that the health record include an informed consent signed by the patient indicating that the patient has been informed of the procedure or operation to be performed, the risk involved, and the possible consequences. Health records also contain incident reports, which contain information related to patient incidents or event occurrences. For instance, if a patient falls during an X-ray procedure, an incident report must be completed immediately after the incident has occurred. Here's an example of an informed consent hysterosalpingogram. As you can see, it includes a description of the procedure that is going to be done on the patient, as well as the risk and possible consequences, the benefits, the alternatives to the procedure, and a required signature of the patient stating that they understand and have been informed of the procedure that is going to be done. A radiology order must be completed first before proceeding any radiologic procedure. The order must include the physician who ordered the procedure, patient demographic information, and a diagnosis or sign or symptom for which the exam is being performed. A radiology report is then created by a radiologist stating the results of the procedure completed on the patient. The report contains a written description of what is seen on the radiographs, the implications for the patient, date and time, and will also include the amount of dose of radiation or radioactive material administered for therapeutic examinations. Here's an example of a radiology report for a chest procedure. At the top, it includes the patient's demographic information as well as the exam that was performed on the patient. It includes the results and findings of the radiograph, and at the bottom, it includes the radiologist's information who reviewed the images. Hospital and physician reimbursement relies on health record data. The diagnostic terminology provided by a physician on a patient's health record is converted into a code and used in a classification system known as ICD-10-CM, or International Classification of Diseases 10th Revision, Clinical Modification. It is used for diagnosis coding in all care settings in the United States. ICD-10-PCS, or International Classification of Diseases Procedure Coding System, is used for reporting of inpatient hospital procedures. On the other hand, current procedure terminology 4th edition or CPT-4 are used for coding diagnostic and therapeutic radiology procedures for outpatient encounters, such as ambulatory surgical procedures. Accuracy in the documentation of the procedure performed on a patient will lead to coding accuracy and will result in proper reimbursement to both the hospital and the physician. When a mistake has been made to a health record, there is a proper method to follow in order to correct the error. When correcting or amending a health record, an author should never erase or use correction fluid. Instead, they should draw a single line through the error, making sure that it is legible, then write the word error next to the crossout, then initial it and date it, and finally enter the correct information. Here's an example of a mistake that could be seen on a patient's health record. As you can see, the author has crossed out the mistake and has written the word error above the entry, as well as providing the date it was corrected, along with their initials, and then continued writing the correct information in the following line. Additionally, when trying to correct or amend an entry in an electronic health record, there are several factors that a radiographer should consider. This includes functionality of the electronic system in use, whether the entry has been signed and considered complete, and the policies of the facility. HIPAA regulations provide confidentiality to health information. Therefore, allowing the patient or patient's representative to have access to the right to request a copy of and the right to request an amendment or correction of the information to their health record. The facility who is providing the patient or patient representative with the health record has the right to require a properly completed and signed patient authorization. Facilities are also allowed to charge a fee for the copy of the health record requested from the patient. Radiographers should keep in mind that no record information should be shared with the patient before, during, or after the procedure in order to avoid misinterpretation of information. To conclude, I have reviewed a few topics discussing health records and health information management. These topics included HIPAA, health record ownership and storage, health record content, health record in radiology, code functions, which were ICD-10 and CPT, correcting or amending a health record, and patient access to a health record. I hope this video has been very helpful in understanding the purpose and importance of health records.